What's a common side effect from this medication? This is a comment we had on a video we made quite recently about spasmodic torticollis, also known as cervical dystonia. So this is a condition where people will involuntarily have tensing of the muscles in the neck, and it can start to pull them across. It can really start to affect their posture. It can affect what's happening with their confidence. It can affect their day-to-day lives, as well as causing symptoms like pain and tension into the area. And it can also then, as it gets worse, start to affect things further down the rest of the shoulder, the arm, the hands, the fingers. People commonly may experience headaches, migraines, or even sometimes in some cases dizziness because those nerves are being pulled and tensioned in that area. And the comment we had from this person was saying about it being a side effect from something they were taking. It's called metoclopramide, and it's not quite exactly the same, but it is very, very similar. So if something is truly going to be cervical dystonia, it should be something which is originating really from the neck, and there should be some level of cause for it. For these kinds of cases, people may take medication, they might try Botox, stretching, they may see a chiropractor, depending, of course, on what is most effective for them. However, in terms of the side effects from this particular medication, metoclopramide, this is actually going to be something slightly different. And it's very understandable why it may be seen as something exactly the same. However, it is slightly different. This is what's going to be called tardive dyskinesia. Tardive dyskinesia is going to be where there's this involuntary movements or actions, but it's a little bit different because if it's something where it's truly this dystonia, this spasmodic torticollis, it should be just around the neck. However, for tardive dyskinesia, which is very common with this kind of medication as well as a few others, it's not just going to be the involuntary movement of the neck, but for some people it may be the mouth, it may be the tongue, it may be almost something similar to Tourette's where they make these involuntary spasms or movements that they don't want to. Some of the other common side effects from this medication include tiredness, fatigue, restlessness, and diarrhea. This medication is usually prescribed for people who have more digestive issues like vomiting, like nausea, like GERD, and in some cases, even for people who have a migraine. The way that this drug works is it's an antagonist. So essentially there's going to be a part of the brain where there'll be these dopamine receptors, and it basically fills the space so that things cannot pass through. It blocks a message because the message that it may be sending through could be for vomiting, for feelings of nausea. The way that this medication starts to then cause this tardive dyskinesia, this involuntary movement, is because it is an antagonist and it blocks receptors. So the receptors may be things like, say, the nausea and the vomiting, but it may also start to block other things. In the brain, in the basal ganglia, it can block what we call a D2 receptor. And if these are blocked, it can lead to basically an imbalance of dopamine in the area. When there's an imbalance of dopamine, it may then start to affect things in different ways. And part of that can be this involuntary movement. And it's not always going to be just at the neck, like we would see in somebody who has cervical dystonia, but it can be for the mouth, for the lips, for the tongue. It could even be for parts of the trunk or for their upper arms. This particular symptom, known as tardive dyskinesia, is more